Hello, my name is Brooke Ponting, and I did my signature assignment on chlamydia. Chlamydia is known as a commonly sexually transmitted infection. Typically, it goes overlooked due to its asymptomatic nature. Chlamydia is caused by the bacterium Chlamydia trachomatis, and if left untreated due to it being undetected, it can cause severe consequences over time to one's health. So, for the remaining of this presentation, I'll be going over the pathogen, its life cycle, the transmission, the symptoms, diagnosis, and the populations that are most affected as well. Chlamydia trachomatis was once thought to be a virus, but due to it having a unique cell wall containing RNA and DNA, as well as ribosomes, it is actually now classified as a gram-negative bacterium. Chlamydia trachomatis targets the epithelial cells of the urogenital tract. However, the rectum, throat, and eyes can also be infected as well. The life cycle of this pathogen has two distinct forms called the elementary body and the reticulate body. The elementary body refers to a small, round, non-replicating infectious form of the pathogen, which is released from ruptured infected cells. In figure 1, you can see this being explained by the elementary body develops into the reticulate body. The reticulate body engages in replication and growth by binary fission. Mature reticulate bodies are reorganized into elementary bodies, which are then released from the host cell. The bacterium can grow intracellularly, which means it can live and multiply inside the host cell, which then contributes to its ability to cause disease to the host, also known as virulence. Chlamydia trachomatis can escape certain aspects of the host's immune response due to its ability to grow intracellularly. The presence of the bacteria inside cells causes a release of cytokines. The release of cytokine provokes inflammation as a defense response, and this defense response leads to tissue damage in the affected area. Scarring can also occur, and when scarring occurs, this is known as a form of repair, which can cause severe effects and consequences on areas like the fallopian tubes for women. Transmission of chlamydia trachomatis occurs primarily through unprotected sexual conduct, which can include vaginal, anal, and oral sex from an infected partner. Typically, adolescent females are more likely to contract and harbor the bacterium due to the bacterium's preference for the infect of the cervix. However, newborns can also contract the bacterium through vertical contact from the pregnant mom during birth. There are a few things that can be done to prevent the spread of chlamydia trachomatis. Practicing safe sexual conduct, like using condoms when having vaginal or anal intercourse, getting tested once a year or after every new sexual partner, and completing the full treatment if you or your partner have contracted the bacterium, and always finishing out the antibiotic as well. These are typically some ways that would prevent the spread. Reinfection in individuals is also very possible if there is sexual contact with the infected partner who has not been treated, because it is highly contagious. Unfortunately, symptoms are typically absent or subtle for most people due to their asymptomatic nature. If left untreated for long periods of time, there can and will be severe consequences, especially if a woman is experiencing symptoms. They may have cervicitis, which is an inflammation of the cervix, discharge, and often salpingitis. Salpingitis is known as pelvic inflammatory disease, or PID, and you can see this in figure 2. So what is happening is there is an infection within the uterus, the fallopian tubes or ovaries, and what happens is there's typically a lot of scarring. Once there is a lot of scarring, this could actually lead to other things like an ectopic pregnancy, where there's a buildup of scar tissue, and if a woman was to become pregnant, the fallopian tube could potentially be blocked, causing a pregnancy within her fallopian tubes, and this could be fatal. The National Center for Health Statistics explains that more than 6 million females in the United States suffer from infertility, with PID being the lead cause. So not only can it cause an infection in the uterus, it can also cause infertility for women as well. About 75% of chlamydia infections show no symptoms, putting women at a high risk for PID, or just damage to the upper reproductive tract in general. However, men do typically feel signs or feel symptoms more than women. So men who have contracted chlamydia trachomatis typically experience inflammation of the urethra. Men may also experience discharge and pain when urinating. For men, if left untreated, it could lead to epididymis. Epididymis is the inflammation and discomfort and pain in the scrotum, testicles, or epididymis. And the epididymis is a coiled tube in the back of the testicles, which store and carry sperm. So if left untreated, this could also lead to a low sperm, or not a low sperm count, but could lead to infertility as well. Now, in some rare cases, untreated epididymis could, Now, in some rare cases, it could lead to the invasion of lymphatic tissues. So, chlamydia trachomatis could invade the lymphatic tissues as well. And this is known as a condition called lymphoma granuloma venereum. So this is when the lymph nodes near the infection begin to fill with granuloma cells. Cells leading to node enlargements and tenderness. So the lymph nodes can cause lymphatic obstruction, leading to deforming leading to deforming edema and genitalia or the anus. So diagnosis is typically very straightforward. For women, a urogenital infection can be diagnosed by vaginal or cervical swabs. A urine test can also be administered. And men are typically diagnosed by having a urine test or a urethral swab. NAATs are the most sensitive and recommended test to detect the bacterium. Now, if a patient tests positive, a typical regimen of antibiotics like doxycycline or azithromycin is definitely advised. Certain populations are more susceptible to chlamydia, particularly young adults between the ages of 15 and 24. The CDC estimates that for every 1,000 people tested, there are 492.2 positive cases, resulting in 1.6 million positive cases annually in the United States. However, globally, the prevalence of chlamydia trachomatis varies with higher rates observed in urban areas. Their reports are globally are 129 million positive cases annually. So, in conclusion, I'd like to say that chlamydia represents a significant public health concern due to its silent progression and typically being asymptomatic. The life cycle of chlamydia trachomatis shows the ability to spread and cause harm, while transmission dynamics show the importance of education and prevention. With diagnosis and treatment being straightforward, it helps create an effective treatment plan, especially if detected early. It's also important that we understand who is most at risk to ensure effective public strategies for for education and prevention of the bacterium. By enhancing our awareness, promoting safe sexual practices, and regular STI screenings, we can combat the spread and protect communities all over the world against the bacterium chlamydia trachomatis. And this concludes my presentation. Thank you so much.